Hi, this is Dr. Kang's Scuba Diving Stories, and today the story is on paranasal sinuses. For divers, paranasal sinus squeeze, we simply put it like a sinus squeeze, is very painful. Not only squeeze, but reverse block squeeze is also very painful. So I would like to briefly introduce you to the anatomy, function, physiology of the sinuses and talk about sinus squeeze. To talk about sinus, we really need to talk about nasal cavity first, because all sinus opens into the nasal cavity, and if there's anything wrong with the nasal cavity, sinus is also in trouble. So what is sinuses? How many sinuses are there? Their function, their disease, some way of diagnosis, and maybe prevention treatment of the squeeze as well. Nasal cavity, there are 4 sinuses which surrounds the nasal cavity. So we have to understand the nasal cavity before we understand the sinuses. So let's take a look at this. There are inferior turbinates, middle turbinate, and it is not shown so clearly, but there's 1 or even 2 more turbinates called the superior and supreme. Floor of the nose and inferior turbinate. Here is some airway. We call it meatus. So this is inferior meatus. Some airway, air passage between inferior turbinate and middle turbinate is called middle meatus. Probably middle meatus is something that all divers should know. So again, turbinate is also called the concha. I'm not really sure how you read the meatus. When it is plural form, it is like a meatai. But anyway, middle meatus is where most of the paranasal sinuses opens into. Here's some other pictures of nasal cavity. So this is inferior, middle, superior turbinates. And when we cut the turbinate out to see the meatus, it looks like this. So turbinate has been cut. So here is what we call middle meatus. Most of the sinus openings, they open into the middle meatus. So if we have some disease here, probably we get the problem with equalization, squeeze or reverse squeeze. So key is all natural ostiums of nasal paranasal sinuses opens into the nasal cavity, and it is middle meatus. Sphenoid is a little different. We'll talk about that later. So what is paranasal sinuses? It's a group of 4. It's a 4 air-filled spaces that surrounds the nasal cavity. But it doesn't mean there are 4 chambers. There are many chambers, but like a maxillary sinus, there are only 1 chamber. But sphenoid sinus, there are much more than that. So what is the function of sinuses? This is from a medical book, and I thought it was funny. It said on the first line, sinuses reduce the skull weight and protect the C-spine. I don't know. Certainly air is lighter than the bone, but already skull is already very heavy. Anyway, sinuses, they produce mucus to protect the airway. Sinuses certainly affect the resonance of voice. It can be a buffer to facial trauma. So a sinus is fractured instead of the real facial bone itself, so it can be a buffer. Sinuses certainly do some humidifying, insulating, heating function for the airs that comes in. Some airs are very hot, some airs are very cold. So certainly sinus, nasal cavity, all airway, they do somehow protect the alveoli from getting exposed to extreme cold, extreme heat. Yes, the immunologic defense, it comes from the mucus that they produce. So there are 4 pairs. They are called the maxillary, ethmoid, frontal, and sphenoid. And let's just look at this one. Maxilla, ethmoid, and frontal. They are all accessible from the front of your face. But this sphenoid sinus is a little different. This is the sphenoid sinus, maxillary, ethmoid, and sphenoid. These frontal also, these opens into the nasal cavity, middle mucus. This one opens on the upper part of anterior wall of the sphenoid sinus, which means they have opening right here. So it's not actually related to other sinuses. Frontal, ethmoid, and maxillary, they almost communicate, but not the sphenoid. So, but still, sphenoid show very little instance of squeeze. I don't remember a single call from divers complaining of some headache that I could suspect the sphenoid sinus. But there certainly can be some. If there is any disease in here somewhere, if it blocks the natural passage. So, maxillary sinus, it is about 10 milliliter. It's not small, 10 milliliter, it's quite a volume. Then ethmoid sinus is along the orbit. It's along the orbit here. It comes all the way down and sometimes go to the posterior part as well. Some of them are very closely related to frontal sinus. So what you see here this is the nasal cavity, and this should be ethmoid sinus, the air cells. But these frontal, it's dyed, it's to show how big the frontal is. But this is somehow connected, or sometimes it's hard to tell if it is frontal or ethmoid. When frontal is very small and it comes down to the medial wall of the orbit, then sometimes we wonder if this is frontal or ethmoid. Like sphenoid sinus, it's in the sphenoid bone behind the nose, between the eyes. So the reason I put this one is sphenoid means like a butterfly. It looks like butterfly, but it doesn't really flies. So let's take a look at some disease of the paranasal sinuses. Infection, we call them sinusitis. Allergy, certainly, yes. Tumors, benign ones, nasal polyp, mostly from the allergy, mucocele, osteoma, these are benign ones. Malignant cancers, yes, there certainly are some sinus cancers. Once we have it, the way we treat it is very destructive. But I wouldn't talk about that. Then we have, as a diver, we have squeeze. This is the polyp, and it is now being very easily removed. We use endoscope and we use a debrider. Okay, it's about the squeeze. When do we have the squeeze? When natural ostium is blocked by the disease of nose and or paranasal sinus. When one-way valve is formed, that can cause a sinus squeeze. If it's the other way around, it can be reverse block, reverse squeeze. So when you have sinus squeeze, what do we go through? Certainly it's pain and discomfort. Bleeding, this is pretty bad, you know. From distance it looked like this. But usually the bleeding comes from sinus squeeze, or sometimes some delayed bleeding can also come from middle ear squeeze. But mostly it's sinus squeeze. There can be some mechanical bleeding from nasal cavity too, but they bleed and they stop. But sinus, you have accumulation of blood and they keep on coming back out through the natural ostium. So to prevent the sinus squeeze, what do we have to do? When we have cold, no diving. When we have nasal cavity and paranasal sinus disease, no diving. We have to treat it, the underlying disease, before we start to dive. When you have pain on your descent, don't descend. But problem is reverse squeeze. You ascend, you feel pain, but you still have to come back out. You cannot live underwater. The pain you feel on the reverse block is really painful. I often get phone calls from the divers suffering from the pain, and they say, "Hey, doc, ugh, ugh." And then I hear some wheezing sound like beep. And then I ask him, "Hey, the pain is gone, isn't it?" That means the enlarged or expanded air somehow escape out of the sphenoid sinus. And they go, "Yeah, oh yeah, it's gone, it's gone." Reverse block, as far as I see, they usually take care of themselves. The situation is over in 1 or even less than that hour. So just prevent the squeeze. It's not a good idea to descend or ascend when you have the squeeze pain. So how do we treat the sinus squeeze? Prevention is the best treatment. It says 10%, 10 gram of prevention is much better than 1 ton of treatment. If you have a squeeze and if you have any complication of the squeeze or reverse squeeze, you have to seek medical help ASAP. Anything can come. Pain you can manage, but if you have inflammation, then that can go toward the worst side of the squeeze. That's most frequently seen complication is infection. You can get a chronic sinus infection, which is sinusitis, then the blood accumulated can change into pus. You have to evacuate them out. How do we diagnose sinus problem? It's endoscope usually show us the nasal cavity, and it shows us the natural ostium of excuse me, of the sinuses opening into the middle mucus. X-rays, simple X-rays, give us some information, but not as much as Paranasal sinus CT. CT is the best way of diagnosing nose and sinus problem. MRI, not really. MRI doesn't show us as well as CT does. Paranasal sinuses. Talked about nasal cavity, what is it, how many function, the disease, diagnosis, and even some prevention and treatment of squeeze. Paranasal sinus, it's something divers should know and act accordingly. Thank you very much. Thank you for your attention.